Bhattacharya is a professor of medicine at Stanford University. His research focuses on the economics of healthcare around the world, with a particular emphasis on the health and well-being of vulnerable populations. He became a well-known commentator on COVID-19 when, in April this year, he showed that the virus is far less deadly than the World Health Organization initially stated. Jay, I'm really thankful for your time today. It's very good of you. The US currently, as I understand it, has a little over 5 million confirmed cases of COVID-19. You've recorded something like 165,000 deaths. It's emotionally and politically charged to the extent that I think it's hard to get a real handle on what's happening and what ought to be done now. Can you give us a feel for what is happening in America and why it's so hard to get the facts out on the table?
Yeah, I mean, it's as you said, politically charged in a way that in my lifetime, I've never seen a medical issue before. And the other thing that's challenging in the United States is that and we talk about the United States as a country, but in fact, it's lots of different regions that are experiencing the epidemic very, very differently. So creating a single national policy is a very challenging thing. I mean, I suspect the same is true in Australia as well. It's very different. Yes. So some parts of the country, like New York, New Jersey, the Northeast, had their bit with the epidemic. I mean, a massive pain with the epidemic in March, April, and they look like they've come out the other side. There are very few cases and very few deaths there now. The South, the Sun Belt, seems to have gone up and now are starting to get on the other side, but they've been through a very rough last few months. And then the rest of the country is waiting nervously to see what happens next. Cases have finally started to come down after the rise, but it's not one country; it's multiple regions, and I think that is politically incredibly challenging.
And you've been responsible for putting some very hard numbers on the table. As I understand it, the World Health Organization initially estimated that around 3% of the people who contacted COVID-19 would die. You put very different numbers on the table, more, I think, in line of 1 or 2 per 1,000. Why has it proven so difficult to get a real handle on the mortality rate of this disease?
I mean, it's a question of what's visible and what's not visible, and hard to see and have to be inferred. It's very easy to see the people that you identify as having COVID, they test positive, what fraction of them die. And the World Health Organization, that's what they were reporting, that 3.4%. The set of people in the early days who were identified as having COVID, 3.3% of those died. And that's just an undeniable fact. You look at the number, you look at the people who died, and you say, wow, this is going to be a terrible epidemic. And it has. It's proved to be a terrible epidemic, but not as terrible as a 3.4% epidemic would be. In particular, what we found out since those early days in January, February, March, is that in fact the disease is much more widespread than you would expect. We know this from studies from around the world. There's now 50 or more studies around the world. I've sort of started to lose track of how many because they all sort of tell the same story. People spread the disease, and about half of them, somewhere on that order, don't actually get very many symptoms. They don't show up for testing because they don't think they're sick, but they have antibody evidence of having the disease. And so when antibody studies are done, in the United States, for instance, the CDC did a study found that 10 times more cases, 10 times more people had antibody evidence than the cases. So you started 5 million. I mean, I think it's probably more on the order of 50 to 75 million have already got COVID in the United States. That sounds really alarming. I just saw a study in Pune, India, 57% or 58%, very, very, very high rate of COVID. Whereas the cases would indicate a very small fraction of that. There's an invisible epidemic going on at the same time as a visible one. And the invisible epidemic is much less severe than the visible one. That's a really important fact, which is like where all of our policies focused on the visible epidemic. Yeah. And our fear is based on the statistics that comes out of the visible epidemic. But in fact, if you want the whole picture, how really deadly is it to me? You want to take into account the invisible epidemic as well.
So to ask a layman's question, you said it was a terrible thing that the numbers might be much higher. couldn't it also be a good thing that it points the way to herd immunity? Is that a possibility? Is that something that might be the other side of the coin?
Yeah, it certainly is a possibility. I mean, I think, it's in some sense, that also is politically charged. Herd immunity means what? Herd immunity means that enough people have got the disease so that if an additional person gets it, they will infect only one other person. They won't infect 2 or 3, and you won't get an exponential growth curve, right? There's a lot of controversy in the literature among scientists about what that number actually is. Is it 80% of the population? Is it 20%? I've seen credible reports on both. The larger number, in some sense, means that we're much further along the epidemic than you might expect. That is a good thing, absolutely. It also means more people have got it, which is the bad thing, right? So it's both, and at the same time, it also means that it's less deadly than that 3.4%. It's much more on the order of 2 to 3 in 1,000. And for children and for young people, it's even lower than that. In fact, for children, I was looking at the numbers for the flu. The flu kills more kids in the United States than COVID has this season.
Yeah, well, the age difference is an important one I'd like to come back to in a moment with some interesting work that's been done in Australia. But firstly, just on this, how bad is it? I think back in April, you said it may be not much worse than nasty bouts of flu or flu epidemics. Broadly speaking, is that still your view?
I think I've revised my view since April. It's worse than the flu. Absolutely worse than the flu. Maybe 2 to 3 times worse than the flu. I think it could be more times worse than the flu, depending on what your view of the flu is. I mean, the flu itself is a nasty disease. If we didn't have vaccines, we'd be facing this every season. So I think I don't want to underplay it by saying it's like the flu. I mean, I think the flu is a terrible disease as well. This is much worse than the flu. Absolutely. It also has different patterns. The age patterns are really important here because it doesn't spread the way the flu does. Children aren't as important to the spread of the disease as it is for the flu, and the disease is less deadly than the flu for young people, and more deadly than the flu for older people.
Yeah, we keep learning more. And I know from my point of view, I was quite strongly of the view that we were overreacting earlier on. I'll admit that. But one of the things that's tempered it, and that I think in this country, the research shows that younger people are actually more worried about the disease than older people, even though they're less likely to get it. But there's another factor in there, and that is that it can permanently damage the health of victims, as I understand it. And if you're a young person, you mightn't be so much worried about dying, but you'd have a very legitimate concern about permanent damage to your body that might play out horribly over the rest of your life. That's something that I don't think I'd appreciated earlier on.
I mean, I think that's true for many viral conditions, that the sequelae sometimes are bad. I mean, so for the flu, for instance, there are neurologic sequelae that are important, even heart sequelae. We're seeing some of that in COVID. The question is, how frequent is that? I think once you account for the fact that this invisible epidemic we're talking about, with so many people already got it, it's likely that's going to be a clinically important thing to think about, but it's not as common as you would think from reading the press about it. I mean, I still think it's a serious condition we should think about carefully, but we live our lives with lots of serious conditions that we think about carefully, and yet still we live our lives. I think to me, I'm a health economist, so I always think about trade-offs. And the question is, what is the trade-off here? If we shut down our lives for an extended period of time, what will we get from it? What will we lose from it? And that to me is the key policy question, right? If we think about shutting down our lives for a long period of time, well, we get unemployment, we get poverty, or especially poor people getting hurt. We get depression, we get suicides, we get long-run health effects of the lockdowns on the one side versus the avoided cases from COVID-19 on the other, right? That's the benefit. Is it worth it? Well, the question is, can we expect the lockdown to permanently address COVID? And the answer is no, right? We have not ever cured or eliminated a disease with a lockdown.
New Zealand's just discovered that.
Indeed, it has. I mean, it's unfortunate, but I mean, New Zealand, of course, is in some sense in a unique place. It's an island, 5 million people. You can actually, maybe if it could work anywhere, it would work there, right? They stamped out the disease, they thought, and yet it's popped back up. I think I was seeing like 70 or 100 more cases already in just the past week. It's an incredibly infectious disease, hard to stamp out, and you can't isolate yourself from the world forever.
And yes, and so you raise, I think, the really important point that there are trade-offs, and we're going to have to make informed decisions. I'm very worried in my own country at the moment. We, like the United States, are a federation. So many of the states here have imposed incredibly severe boundary restrictions, border restrictions, but the premiers and the state governments don't wear the political cost of those tough decisions, which are very popular. The Commonwealth does, because the Commonwealth's providing the financial support for people who are out of work or looking for work in these very difficult circumstances. So at vast cost to the next generation, we're keeping our economy going. But the damage is being exacerbated by the lockdowns. And this leads us back to the whole crippling Western problem, if I can put it that way, of no longer being able to have rational debates about trade-offs. And I'm wondering just how much economic and social damage we're going to do if we can't advance this debate. And yet, on the other hand, if it's not conducted rationally and sensible precautions are not taken, you get the sort of problems in areas that you've seen in America.
Yeah, I mean that's what I'm really afraid of too. We have premised our policies on this, I think, false idea that somehow we can just go back to a time before the disease was here and eliminate the disease. That is not true. It's not possible. We have to accept reality and say, okay, how can we learn to live with this disease and this epidemic? And the cost of the lockdowns shouldn't be more than the cost of the disease. And it's hard because, as you pointed out, in the Australian context, and it's true everywhere, the cost of the lockdowns fall on different set of people than the people who get the disease. You're making choices between lives and lives on one side, lives on the other side. The issue is that the lockdown is going to impose costs on different people than COVID will. And it's not simply dollars. I mean, unemployment, of course, is bad, is dollars, but it's also lives, right? So suicides, actually unemployment itself and economic damage itself poses cost on health. And we know that that's long-term costs. Life expectancy goes up with rising income. I was looking at the IMF forecast for Australia, and it says right now it's 4.5% reduction in GDP just for this year. Yeah, and that's before the most recent shutdown.
Well, exactly. It will be more. And that, as a former legislator and somebody who was at the heart of an economically reformist government, that, I've said it many times before, and some of my people will write in and say, stop telling us, but we actually eliminated all Commonwealth debt in Australia. And now we're flat out going back into serious debt, and our children are going to inherit that. And it will impact on their lives. But just on the non-economic costs, and I must say I'm very critical of some of the media who are all for lockdowns to save people's lives. And of course that's important, but it can be, very emotionally lopsided, or lopsided in terms of the emotions that feeling plays to, or those reporting plays to. There's modelling conducted by Sydney University's Brain and Mind Centre, and backed, I'm told, by the Australian Medical Association, says that the annual rate of suicide in this country can rise from an already pretty staggering 3,000. I mean, in a country like Australia, we are so fortunate. It's already 3,000 to 4,500, another 1,500. That is, suicides and youth suicides would make up half that increase. It's a very powerful pointer to some of the human, not economic costs of these lockdowns that are not being taken into account.
I mean, John, that has me very, very worried. The suicides themselves, but also even more broadly, we're asking our youth to pay the costs of that's who pays these costs of these lockdowns. You have delayed schooling, essentially schooling online instead of in person. We have, young people are meant to be in company with one another. We're not meant to be alone. It's extremely costly from a social development point of view to have that, and it's those young people that are paying those costs. It's fine for me. I can sit in my nice office and talk with Zoom and keep doing my job. That's fine. But it's also poor people that are paying the cost. The people who can't afford to do what I'm doing. I think that the unequal distribution of this is absolutely devastating. It's poor people and young people that are paying the cost of the lockdown, and they're not the ones that are benefiting, because they are experience the damage of COVID at a much lower rate. So that is the poor people, the young people.
And now this leads into another concern I have about what's happening in the West with our atomization, the fracturing of our society, where, if you were from Mars, you'd say we all seem to be at war with one another, gender lines, race divisions, and what have you. But now we're heating up an intergenerational battle as well. And I think that is really troubling. The blunt reality is that even when this is over and we've found some accommodation and returned to some degree of normality, assuming we do, the debt hangover will fall unbelievably on the shoulders of young people. And I find that deeply disturbing. They will be very resentful. Many older people will not only be probably insulated, but in following on the pattern since the great financial crisis, their assets seem to go up in value. They become wealthier, and younger people are locked out of the opportunity to advance their housing interests and their lives. So I just don't think enough account is being taken of these things.
I agree with you, John. I think in the United States, I think we're at $27 trillion in debt and counting. And there's a debate over how big the next stimulus package is going to be. Where does that money come from? Partly it'll come from me. I'm 50. I'll have to pay for it for some time. But it's going to come from my kids. It's going to come from the younger generation who will have that debt hanging over them for the rest of their lives. Is it worth it? That's the thing. It's like we almost haven't asked that question. We've just said, okay, we have this COVID disaster. Let's pay any cost whatsoever to get out of it.
Yeah. But it's not, as you said, it's not just economic cost, the social cost, and even the cost to lives, as the Sydney University study suggests, may be far higher than the actual disease imposes on us, and it's not being reported. People are not having this information put before them. So I hope as many people as possible listen to this and ask the sort of questions that arise out of it.
Yeah, I think it's, if you want to make rational policy, you need to have projections, right? So it's inevitable. And we've seen our fill of disease projections. They're everyone is talking about what will the track of COVID look like if we lock down, if we don't lock down. What do these epidemiological models say? And it's completely reasonable. One ought to have them. But at the same time, side by side, when you're making a decision about a policy, you want to look at both the benefits and the costs. We should have projections about the lives that'll be the cost of these lockdowns. The cost in lives of these lockdowns. What health costs will there be? What mental health costs? What suicide rates? What unemployment? How many people will lose their jobs and thus not develop experience so they can their human capital so they can constructively engage with the labor market later. And we know all that kills as well, right? It's not simply costless. I lose money and I go on with my life. If you cut down schooling, less well-educated populace will be less healthy 10 years from now. So I think and you can say, look, these are uncertain. That's true. They're uncertain. That's why we have models to try to address that uncertainty as best we can. And the disease models themselves are uncertain. They haven't done a very good job either in tracking the disease, as you probably know, in projecting the disease. So it's uncertainty on both sides. It's not an excuse not to consider both all the costs and the benefits together when you're making decisions about policy.
Do you feel we can do better? How do we do better at engaging people in a real debate about the trade-offs and the need to make more rational decisions? Because we're not very good at it now in our cultures. We were once, but we're not now. How can we get a better debate around this so we get better policies for the sake of our children in particular?
John, I think part of it is we have to address our fear first and foremost. I think that more than anything else has driven the division over COVID policy. This abject fear of what the disease is. It's a deadly disease. One should be concerned, but should one put aside one's rational faculties in order just because of that fear? It makes no sense. Let's look and see, okay, how deadly is it? Let's actually consider all the costs and all the benefits. And I think we have to get back to that kind of thinking, that there are trade-offs. We can't live in a utopian world where we can pretend that the virus will somehow disappear if we just shut down hard enough. If we just pay enough pain and cost, it'll go away. I mean, that's not feasible. I think that kind of reality, I'm actually, in some sense, John, I'm kind of hopeful. I mean, I think I'm starting to see some sense that, look, we have to think about the cost. I saw yesterday, I saw a story that apparently in South Korea, there was a massive protest over this very severe lockdown they've had for a very, very long time. People around the world are feeling these costs, really feeling them. And again, it's not just to their pocketbooks, it's their entire lives. Like, what is the purpose of our lives if not to live them? So I think that kind of thinking will start to take over, because it's too real, John. I mean, you can't just pretend like it's going to just end. When will it end? We hope for a vaccine. I hope for a vaccine, but do we really premise all of our livelihoods on whether a vaccine can be produced in an absolute record amount of time? I mean, we should invest in it. We should do the science as rapidly as we can, make sure that the data on it are clear so that we understand if the vaccine is produced, it's safe. But should we bet our entire society on that one outcome? Seems like an unwise bet.